A 40-year-old man comes to the physician for headache and dizziness. He was recently diagnosed with hypertension. His only current drug is lisinopril. He enjoys camping and often hunts for wildlife and drinks from streams when doing so. An arterial blood gas reveals the following: arterial PO2, 100 millimeters mercury, arterial PCO2, 38 millimeters mercury, arterial O2 content, 12 milliliters oxygen per deciliter, normal range 16 to 22. Which of the following is the most likely explanation for these findings? Choice A, reduced red blood cell count. Choice B, oxidation of metalloprotein bound cations. Choice C, cyanide poisoning. Choice D, carbon monoxide poisoning. Or choice E, lead poisoning. I'll wait 5 seconds and answer the question. This patient has a regular level of PO2 and PCO2 despite a low total arterial O2 content. So this already narrows your differential to a number of conditions. But what this question also adds in is that he likes to go camping and drinks from streams. This is a very buzzy descriptor for a risk factor for basically nitrate or nitrate exposure, which is a known cause of methemoglobinemia, where the ferrous ion, which is Fe2 plus, it's oxidized into ferric ions, Fe3 plus, on the hemoglobin, which does not bind oxygen as well. So choice B, oxidation of metalloprotein bound cations, is the correct answer. Now, as for the other conditions that can cause these sort of lab findings, they're actually in the choices here, so let's just take a quick look. Choice A, reduced red blood cell count. This is obviously referring to anemia. So anemia of any kind can actually show similar findings because, well, what does PO2 and PCO2 mean? It means that the gases dissolved in the blood plasma are normal. So in the setting of anemia, there's nothing wrong with the plasma. I just have less red blood cells. So of course I would have less oxygen bound to hemoglobin because there's just less hemoglobin in general because I have anemia. So it could cause these lab values as well. But this patient has no risk factors or typical symptoms of anemia. I mean, he wasn't bleeding or anything. And he's not a female patient either, with dysmenorrhea or something. There's a different risk factor being presented to you here. So even though anemia can be something that causes these lab findings, it's not the best answer choice here. Choice C, cyanide poisoning. So in cyanide poisoning, you would have normal arterial oxygen content and you would actually have high venous oxygen content because what cyanide does is that it actually disrupts cellular respiration at the mitochondria. So there's no problem with the carrying of oxygen on your hemoglobin. You have a problem using up oxygen once it gets to the tissue because cellular respiration is being blocked. And as far as this question is concerned, there's something of a distractor here where I tell you he has hypertension, because nitroprusside is one of those buzzy drugs they tell you about that can cause cyanide poisoning. But obviously, I told you that he's only taking lisinopril, so there's no reason for you to think he has cyanide poisoning from some kind of drug he's taking. Choice D, carbon monoxide poisoning. Carbon monoxide poisoning can also cause these findings where you have regular levels of PO2, PCO2, and then low total arterial O2 content because CO occupies the binding site for oxygen and hemoglobin, and it will cause it so that hemoglobin will not carry O2 as much, right? But just like with anemia, the exposure risks here don't fit carbon monoxide poisoning. Carbon monoxide, you usually think smoke or exhaust, like fires, heaters, gas stoves. That's not something that was given in this question, so it's the wrong answer. Choice E, lead poisoning. Lead poisoning can cause sideroblastic anemia by inhibiting heme synthesis, so which can lead to iron buildup in the mitochondria of developing red blood cells. You can also see basophilic stippling in lead poisoning. There's usually not any specific arterial blood gas findings that you would find with lead poisoning. So it's just not really a good answer choice at all in this case. So bringing it back, you want to know this kind of presentation in lab values where they give you PO2 or PCO2 are normal, where the blood gases are dissolved fine in the plasma, but then the total arterial O2 content is low, which means there's something wrong with the hemoglobin typically. And as mentioned, it could be because you have low amounts of hemoglobin because of anemia. It can be because of CO poisoning, which takes up the space where oxygen goes and doesn't allow oxygen to bind. And very similarly, you can have some kind of exposure to either a drug or a nitrate that gives you methemoglobinemia, which is just where the Fe2 plus iron is replaced with Fe3 plus iron, which also doesn't bind oxygen as well. I hope you found this video helpful. I'll see you in the next one.